So please join me in welcoming our speakers to this webinar. We're pleased to be joined by two excellent presenters. Our first presenter kicking things off is Suneet Jaswal. Suneet is a registered dietitian at Calgary Meals on Wheels and has a master's degree in applied nutrition from the University of Guelph and a bachelor's degree in nutrition and food with a minor in psychology and a certificate in food insecurity from Toronto Metropolitan University. With his extensive experience in both clinical and community tradition, he works to improve food security and ensure vulnerable populations have access to nourishing, balanced meals. As a caregiver for his 98-year-old grandmother living with dementia, he has a personal understanding of the physical, emotional, and mental toll caregiving can take. Drawing from a background in menu development and nutrition analysis, Suneet is passionate about making nutrition practical, accessible, and supportive for both caregivers and those they care for. Our second speaker today is Christine Henschel. Christine is the manager of strategic initiatives and partnerships at Calgary Meals on Wheels. She oversees community partnerships that support new connections and programs to build greater collective impact, and she contributes to collaborative committees and projects in the sector. Christine is also the resident data guru, something I always appreciate and like, and leads internal projects to strengthen and enhance operational efficiency. Her entire career has been in the nonprofit sector, over a decade of which has been at Calgary Meals on Wheels. I welcome both of you to today's webinar and turn it over to you, Suneet, to start things off with the presentation. So thank you for joining us today, and it's all yours.
Thank you for that lovely introduction, Keith. Get my screen shared here. All right. Everything okay, Keith?
Everything looks great.
Perfect. Okay. Good afternoon, everyone. My name is Suneet, as Keith mentioned, and today we'll be doing a webinar on nutrition for caregivers. Caregivers are often a forgotten pillar of the healthcare system. They're excluded and overlooked during the healthcare process of care recipients. Even in my training just a few years ago, the emphasis is always on tailoring interventions specifically for the patient without too much regard for the people that are around them. It wasn't until I started working that I had to unlearn this and to try to take a more holistic and familial approach. So with that in mind, let's begin. As Keith mentioned, before we dive in, I'd like to share my personal connection to today's webinar. I'm not just speaking as a dietitian today, but also as a caregiver for my 98-year-old grandmother who lives with dementia. And actually just 2 weeks ago, she fell and broke her arm. So I know what it's like to juggle appointments, meals, emotions, and exhaustion all at once. I've learned that while sacrifices may need to be made, nourishing myself is essential to sustaining the care that I provide. In the first half of today's webinar, we'll take a look at what the research tells us about how caregiving impacts your health and how nutrition is connected. Then in the second half, we'll discuss strategies to support your nutrition and highlight helpful tools and resources. So let's begin with the health impacts of being a caregiver. First, let's take a look at some stats. Right now in Canada, about 25% of the population is in some sort of caregiving role, even though many of them may not identify as a caregiver. Caregivers currently provide up to 90% of the care in the community and up to 40% of the care in continuing care facilities, such as long-term care homes. While these are pretty staggering numbers, they will unfortunately likely increase over the next decade or two as our population continues to age. People are choosing to age at home rather than moving to long-term care facilities, which will cause the caregiver burden to increase in the coming years. So how does being a caregiver impact your health? The literature that I reviewed points to three main categories: financial health, physical health, and mental health. While we won't focus on it too much in this presentation, it's important for us to recognize that money influences almost everything we'll talk about today, especially your access to food. Caregivers often lose income while taking care of the care recipient. They may reduce their work hours, transition to less demanding jobs that are therefore lower paying, or they may leave the workforce entirely to help them juggle their time. After stepping away from unpaid work to provide care, Many caregivers find it difficult to re-enter the workforce. Caregiving isn't usually acknowledged as work experience, and employers may see that resume gap as a disadvantage. And lastly, there was one study that looked at out-of-pocket expenses and found that caregivers spent almost $2,000 over the span of 6 months to pay for medication, medical supplies, transportation, and nutrition supplements. This is a pretty significant amount of money, especially when your income has already been reduced. Being a caregiver and all of the related financial impacts can have a pretty significant impact on one's mental health. Caregivers experience a lot of psychological distress, which is an umbrella term for stress, anxiety, or depression, but it also includes feelings of loneliness, feeling overwhelmed, and feeling sad. Caregivers experience more stress, anxiety, and depression. In particular, they experience depression at 4 times the rate of the regular population and are 3 times more likely to seek treatment for anxiety. Caregivers are also pulled away from their social life as caregiving responsibilities take over their time, and this leads to social isolation and decreases in quality of life. Even once caregiving responsibilities end, the mental health of caregivers doesn't necessarily improve. There can be a sense of relief, which can lead to caregivers feeling guilty. The burnout of caring for someone can hit you all at once at the end, and sometimes family issues may arise during caregiving, such as resentment towards family or friends who were absent or distant during the care process. And so all of these factors can cause your mental health to continue to remain poor even several years post-caregiving. Compared to mental health, physical health appears to rebound a little bit quicker, but there's still some pretty significant health impacts. Caregivers are often tired and experience insomnia, which can be caused by sleep disturbances, such as helping your care recipient go to the bathroom at night. Caregivers use 39% more medication than non-caregivers. This can be something as simple as taking some extra Tylenol to manage a headache, to the increased use of drugs like benzos, which are used to manage anxiety, insomnia, or panic attacks. Specifically, caregivers that take care of their spouse experience greater psychological distress and stress compared to other caregivers, and this actually increases their risk for early death. Caregivers are at an increased risk for chronic disease, which is any long-lasting health condition, such as diabetes, heart disease, obesity, or high blood pressure. And the stress of being a caregiver often causes them to make poor dietary choices, leading to malnutrition, and we'll talk about that a little bit later. This slide in particular may be distressing to some people in attendance today, but it's important to note that improvements in your nutrition can significantly reduce your risk for everything on this slide. So after kind of going through all that doom and gloom about the health impacts of being a caregiver, I wanted to share this quote from a book I read earlier this year. To an extent, you are sacrificing your own well-being to improve the well-being of someone else. And so caregiving is hard because it is. So with all of that in mind, how does that connect to nutrition? I mentioned malnutrition, but what is that? Malnutrition is any imbalance between your nutrient intake and the needs of your bodies. It can come from undernutrition, where you're not eating enough calories or nutrients, which leads to weight loss or nutrient deficiencies, but it can also be from overnutrition, where you're eating too many calories, which can cause weight gain. Caregiving responsibilities often take precedence over self-care, and as I mentioned earlier, the stress from being a caregiver often causes them to substitute healthy food for convenience foods, which are usually high in calories but low in nutrition. Think of things like cookies or chips, which are high in calories but don't provide you with too many vitamins or minerals. This is called hidden hunger. Hidden hunger is difficult to diagnose because we often use changes in weight to diagnose malnutrition. We find that this happens most often in the caregivers of children or the caregivers of adults living with Alzheimer's or dementia. Children and people with dementia can often fall into routines and become picky eaters. And so instead of making 2 separate meals, caregivers may eat the same food as their care recipient, which increases their risk for nutrient deficiencies and malnutrition. Malnutrition can increase your risk for death and disease, often due to poor immune function, leading to an increased risk for infection and illness. As I mentioned, there's an increased risk for chronic disease. And then, knock on wood, if you do end up in the hospital for any reason, your recovery will be slower, which leads to extended hospital stays. And then lastly, long-term malnutrition can increase sarcopenia, which is the natural muscle loss we experience starting at the age of 30. Muscle is one of the strongest predictors of independence in older adults, and losses in muscle or strength can decrease your quality of life as you become weaker and as you age. So then, with all of that in mind, how should we eat as a caregiver to prevent malnutrition, and on this slide, to protect our mental health? Inflammation is a fancy buzzword that gets thrown around a lot. For short periods of time, inflammation is actually good for you. Inflammation is your body's first responder. It tells your body that something needs to be repaired or fixed. As an example, it's like that small amount of swelling you get when you're bitten by a mosquito or when you get a cut on your finger. Poor nutrition and stress can cause chronic inflammation. This is the equivalent of the fire alarm going off and then never turning off. Your body keeps triggering your immune system over and over and over because it thinks something needs to be fixed or repaired. But this chronic response actually damages the healthy parts of your body. And there appears to be a link between this inflammation and poor mental health. So, a frequently studied treatment for mental health in terms of nutrition is an anti-inflammatory diet to reduce that inflammation. So, the main diet eating pattern associated with being anti-inflammatory is the famous Mediterranean diet. All that really means is eat lots of fruits and vegetables, whole grains, beans and lentils, and healthy fats from vegetable oils, seeds, nuts, and fish. Some new research actually came out last year that showed that if you follow the Mediterranean diet, but also restrict your sodium or salt intake, you can actually lower your rate of stress, depression, and anxiety. The combination of a Mediterranean diet plus a low sodium diet is called the MIND diet. So while these findings are interesting, we also have to keep in mind that they're very new, and so there's not enough data yet to suggest that this is something we should in fact do. In terms of nutrition and physical health, the research shows that caregivers don't get enough of a certain set of nutrients. They don't get enough calories, which leads to malnutrition and weight loss. They don't get enough protein, which causes them to lose muscle, and it impacts their immune system, increasing the risk for getting sick. Caregivers also tend to have low iron, and foods high in protein tend to also be good sources of iron. Low vitamin C, which comes from fruits and vegetables, which can impact your immune system, and low vitamin C also increases the inflammation we talked about in the last slide. Low folate, which increases your risk for cardiovascular disease and a type of anemia, which can contribute to that fatigue. Folate is also found in fruits and vegetables. And then lastly, low fluids. Caregivers don't drink enough, which decreases their ability to absorb nutrition, and that actually ends up making everything else on this slide significantly worse. So putting those past two slides all together, what should we look for? Caregivers need to keep an eye on their calorie intake, their protein, get plenty of healthy fats from seeds and nuts, and eat lots and lots of fruits and vegetables. This will help protect their mental and physical health. Your health as a caregiver plays a vital role in the health of your dependent. Studies show that the stress of being a caregiver leads to poor dietary choices, which negatively impacts your health, causing the quality of the care that you provide your care recipient or your loved one declines. As your level of care gets worse, that leads to poor health in your care recipient, which leads to an increased risk for falls, infections, or illness, which then increases your burden and stress as a caregiver. We want to stop the cycle here by coming up with strategies to improve the diets of caregivers so that way your health is not negatively impacted. I came across this cartoon that I wanted to share. It's an illustration of the idea that you need to take care of yourself before you can take care of others. It's a slight spin on the phrase, "You can't pour from an empty cup." So we just went through a lot, but fortunately there is research showing that we can improve the health of caregivers through two main things. The first thing is nutrition education, and the second thing is improved access to nutritious food. I hope today I can provide you with some nutrition education and tips and help you get started on your wellness journey. So how do we take care of ourselves? As silly as it may sound, remember to eat. Sometimes caregiving responsibilities, can become so overwhelming that we don't have the time or energy to eat something ourselves. This can cause fatigue, low energy, and make you irritable. Try to eat at least every 3 to 4 hours. Chances are that as a caregiver, you already have a schedule for when you want your care recipient to eat. Add yourself to that care plan and use feeding times as an opportunity to eat something yourself. Keep frozen and canned products at home, such as frozen fruits or vegetables, or things like canned tuna, beans and lentils, or soups. These items can make meal prep a lot easier by taking some of the labor out. There tends to be a myth that frozen or canned fruits and vegetables are less healthy for you, but actually, in many cases, they have more nutrients in them compared to their fresh versions. Along with ingredients, also keep frozen meals and snacks on hand. If you do have a busy or overwhelming day, it's a lot easier to microwave a Hot Pocket or a pizza pop than it is to make yourself a meal. Eating something is always better than eating nothing. This is a method I often use with clients. The goal is to follow Canada's food guide. A meal should consist of a starch or a grain, such as rice, bread, or pasta, some protein, such as cheese, meat, eggs, dairy, or tofu, and some fruits or vegetables, such as apples, peas, carrots, or spinach. Combining all three of these components ensures that you're getting enough nutrients to support your health. I ask clients to look at the meal in front of them, identify the parts, and add whatever is missing. 9 times out of 10, usually people are missing that fruit and vegetable component that tend to be very high in those minerals and vitamins that caregivers tend to lack. So let's use that Hot Pocket from earlier as an example. The Hot Pocket is covered in a bready crust, which is your grain, and then it's filled with cheese and meat, which is your protein. To help make that Hot Pocket a complete and nutritious meal, all we need to do is add some fruits or vegetables. This can be as simple as chomping on a cucumber, microwaving some peas and carrots from the freezer, or just eating a banana. The simple addition of a little bit of fruit and vegetable covers the nutrient gaps of the Hot Pocket. So this applies to meals, but I like to take a slightly different approach for snacks. For snacks, there are 3 main pillars, and the goal is for each snack to have at least 2 out of 3. Your pillars are protein, such as eggs, dairy, seeds, or nuts, carb, fruit, or veg, so things like fruits or vegetables, or bread, cookies, chips, popcorn, and then last is fat, seeds, nuts, or avocados. Notice that seeds and nuts fall under both protein and fat. I find that as long as you add some sort of nuts or seeds to any snack you're having, you will likely hit at least 2 of those pillars. Some examples are apples with peanut butter, which gives you the apple as your carb or fruit, and the peanut butter, which are seeds and nuts, which is your protein or your fat. Greek yogurt and frozen berries, so you're getting your protein and then your fruit. Often, when we crave something, it tends to come from that middle pillar, things like cookies or chips. So simply adding a little bit of peanut butter helps round that snack out. Some snacks also naturally have all 3 components. So things like granola bars or trail mix, they have seeds and nuts, granola, dried fruit, which makes them a nutritious and wholesome snack. One of the main methods you can use, and one of the easiest, is to make nutritious swaps of the foods you already purchase. The main downside is that this tends to increase your costs. which means that this approach may not be for everyone. So how do you figure out if a food product is better for you? What we want to do is compare the nutrition facts of two similar products. So the next time you go shopping at a grocery store, pick up 2 loaves of bread. You want to ideally compare bread to bread, things like milk to milk. Don't compare different products because that will change your serving sizes. As a caregiver, we know the main things that we want to focus on are things like fiber, protein, and your vitamins and minerals. These are all good nutrients. So higher the number, the better that food is for you. Subnutrition labels will include more detail, such as healthy fats, which are your poly and mono unsaturated fats, or other vitamins and minerals. These are also all good nutritions. So again, higher the number, the better it is for you. So let's take a look at 3 quick examples that I personally use. The first example is pasta. On the left, we have kind of your everyday regular pasta, while on the right, we have a legume-based pasta. And these pastas, the only thing that's different is the manufacturer has added things like edamame, lentils, or beans to increase the nutrient content of the pasta. As we can see, the legume pasta has more fiber, has more protein, and also has more iron. However, per portion, it is also double the cost. Another example is sprouted or whole grain bread. On the left, we have white bread, and on the right, we have the whole grain bread. The whole grain bread has more healthy fats, has more fiber, and more protein. But the 2 slices will cost you almost 50% more. Lastly, we have ultra-filtered milk. Ultra-filtered milk has double the amount of protein, almost double the amount of calcium, vitamin D, and many other vitamins and minerals like vitamin B12 and zinc. However, despite that, it is also 2.5 times the cost per cup. I have the privilege of being able to afford these products and this milk in particular. So I actually almost exclusively use this for my grandmother and myself because the increased calcium and protein reduces my stress of worrying about our bone or muscle health. But again, these approaches aren't for everyone. So what is something that's a little bit more accessible to more people? This is to try to increase the nutrients of the meals that you already eat by making small adjustments or adding in a couple of ingredients. This approach is a lot more affordable because we're only making small changes, but those changes are very nutritious, and so they add up over time. Skim milk powder is shelf stable, but it is also a fantastic source of protein. You can add a spoon to smoothies, oatmeal, or even cream-based sauces. If you're someone that is struggling to manage your weight, adding a little bit of margarine or butter to your meals is a very easy way to add in extra calories. For example, the simple act of just buttering both slices of bread before making a sandwich can really help you maintain your weight. We do this very often in long-term care homes. And then lastly, silken tofu is a fantastic source of protein and calcium. Silken tofu is just a very, very soft tofu. It blends into a creamy paste, so it works really, really well in smoothies or pasta sauces, but you can actually blend it together with some melted chocolate and you get a high protein chocolate pudding, which works amazing as snacks. Next, we have our seeds and nuts, which as we mentioned are a great source of healthy fats. As silly as that picture on the right may look, simply adding a few seeds or nuts to each meal will add up over time. Frozen greens are a fantastic source of folate and vitamin C. Adding a small chunk or handful to pastas, blending into sauces, or just throwing into soups is a fantastic way to sneak some nutrients in. And then lastly, you have things like edamame, beans, or lentils. These are a fantastic source of everything from fiber, protein, and lots of vitamins and minerals. And they're also very cheap. So I tend to recommend use them to bulk out your meals as a way to increase the nutrition of your meals while keeping costs low. I often suggest throwing some edamame into the water as you cook your rice to make it more nutritious, throwing in a little bit as you're cooking your pastas, or using it to replace some of the beef in your taco fillings. One of my favorite methods is actually using cannellini beans or white kidney beans. You can blend them with some hot water and then freeze portions in an ice cube tray for up to 6 months, and then pull out a portion each time you need something, each time you need one. As I mentioned in the previous slide, beans are a fantastic source of protein, lots of minerals, and lots of vitamins as well. So how can you use that pureed bean? You can add it to puree. You can add that puree, to egg salad, tuna salad, or chicken salad sandwiches. It works great in white sauce pastas or mashed potatoes. You can even add a little bit into soups and stews or baked goods. And if you add just a spoonful or so to some beaten eggs, it will help make your omelet or scramble a little bit more fluffy, but also a lot more nutrient dense. And it also acts as a fantastic replacement for a typical sandwich spread. So we've talked about how to increase your nutrition through what a meal and a snack should include, and some small additions you can make to the food that you already eat. So the main thing that's left is your hydration. Keep fluids such as water around you to encourage you to sip regularly. The easiest way is to just keep a water bottle on hand. As we age, our thirst cues become less and less reliable. So this is especially important for caregivers that are also older adults. Drinking water can get pretty boring, so feel free to flavor it, cucumbers, lemon, berries, or even water enhancers like Mio. And there tends to be this myth that things like coffee and black tea will dehydrate you because of the caffeine. This isn't true. Coffee and tea are still hydrating, but maybe let's try to limit ourselves to about 3 cups per day so we're not overdoing it on the caffeine, which might cause you to crash and have fatigue and become irritable later in the day. So I just threw a lot of tips and recommendations at you, so it's natural to feel overwhelmed with that amount of information. The goal is progress. Do one baby step at a time and only add in other changes once you're ready. For example, if you think the hydration tips are the easiest for you to implement, start with that, do it for a few weeks, and then move on to snacks. This will improve your well-being over time. Notice that at no point I told you to stop eating anything. I only ever said to add things. The goal is to nourish your body. And so what we want to do is make small additions to your daily life because that is sustainable, will improve your diet quality, and improve your well-being. Before I wrap up my portion and pass it on to Christine, I want to quickly talk about some useful resources. First are some caregiver supports. The book I quoted earlier is No Love Like It, Feeding Someone Who is Sick. Dr. Morley talks about her experience as being a dietitian and a caregiver, and kind of how those feeding relationships change when someone is sick. There are no nutrition tips or advice because it is a self-reflective book where Dr. Morley introduces ideas and asks you to reflect on them. The next is for any healthcare professionals in the room. Caregiver-centered care is a set of modules created by the University of Alberta on how to include family caregivers in the care planning process. And these modules are actually also hosted on the Caregivers Alberta website. Alberta Health Services actually just recently launched their nutrition checkup for older adults. So whether you're a caregiver or provide care to an older adult, this nutrition quiz will give you a personalized report with tips and resources to improve your nutrition. You can access it via this QR code or from ahs.ca/older adult nutrition. These slides will be shared, so you'll be able to access that link then. If you can, reach out to a dietitian to get that personalized care that you need. You can access them for free with a referral from your GP or 811. And if you have private health insurance, such as Alberta Blue Cross, you likely also have coverage for a private dietitian. You can find local dietitians through the dietitian directory or Lumino Health, which allows you to search for any health practitioner, but also lets you see their ratings. So you can see how patients and clients rate the services of the clinician you're looking at. Lastly, I want to mention 2 recipe supports. Cookspiration provides dietitian-approved recipes and includes a meal planner to take away some of that stress of meal planning. And Supercook is a very helpful recipe search engine. You tell it which ingredients you have at home, and it will only show you the recipes that you can make with what you already have on hand. which is very useful if you're short on time and don't have time to make a trip to the grocery store. You'll recall that there are two ways to improve your health as a caregiver: nutrition education, which is what we did earlier today, and then improved access to nutritious food. If you can, rely on food supports, and there are a lot of Meals on Wheels styles of services throughout the province. So I'll now pass it on to Christine to talk more about that.
Thanks so much, Suneet. That was a really great overview of a lot of that nutrition education piece that you were talking about. So now we're going to switch tact and talk a little bit more about how we can improve access to nutritious food to help improve the nutrition for our caregivers. But what does access mean? Well, access encompasses a lot, actually. It can be the capacity for meal planning. It can be the proximity to the nearest grocery store. It can be the energy left at the end of the day to prepare a healthy meal. And today, more than ever, it can also be the costs that force trade-offs or a tighter budget. So how do we improve that? Well, we need to find ways of making and acquiring the ingredients and preparing our meals easier. So when I grew up, child of the 90s, we only had two options for food delivery: Chinese food or pizza. Nowadays, we have nearly every restaurant, grocery store, and convenience store within a certain radius of our homes at our beck and call. So to help ease our access to nutritious food and meals, let's consider some of these somewhat obvious supports, but I just want to remind us that these are there to support us. So shopping sales, those loyalty programs, and discount days at your local grocery store. Most big chains have one or more of these kind of programs. And just by shopping at the same place and acquiring those points, or by shopping on a specific day of the month when they have their customer appreciation day or their seniors day, can then help make your budget go further with your grocery bill. Then, of course, online grocery shopping became a really big thing during the pandemic and continues to help out. When you do your online grocery shopping, it shortens that burden of the grocery shopping, because then you can just do it from your couch at 10 p.m. in your pajamas. And my favorite part of the online grocery shopping is that I don't have to drag my little loved ones through the entire grocery store and add that stress to my day. If you take it one step further, you can also get groceries delivered right to your door. And usually there is a fee for this service, but there are some workarounds. So for instance, I've heard that the PC Express Pass, which is only about $30 for the first year, gives you free unlimited deliveries for grocery delivery. So by using some of those workarounds, you might be able to reduce those charges. And then, of course, there's meal kits, which provide the pre-packaged and pre-prepared ingredients along with a recipe card right to your home. And then you can actually put it all together and cook it yourself. And then take it a next step further, there's also meal delivery services where the entire prepared meal is delivered right to your front door. Now, those meals come in a variety of different formats and from different sources. It might be a restaurant around the corner that you're getting through Skip the Dishes, or it might be from a regional meal production facility that is selling these meals as a service. So all of these are different for-profit companies. So their services usually come at a cost, but by using those loyalty programs, those points, maybe a sign-up promotion, you might be able to help reduce some of the costs of using these convenience services. And a bonus is that a lot of these services are what I call giftable. So you can easily get a gift card for most of these retailers online on their website or in store. And so when somebody asks you as a caregiver, what can I do to help? You can very easily mention where your favorite grocery store is or what service you use for meal delivery. And that way they can hopefully help in a meaningful way that helps you access more nutritious food. Now, the logos here are all just a small sampling of companies that are local to me that I'm aware of. I'm not endorsing any of them, but I do want to remind you of these services, as caregivers absolutely deserve some of the convenience that these types of services offer. And you might have to do a little bit of legwork to find the ones that are relevant to you in your area. And unfortunately, with some of the rural and remote areas, there may not be quite as many delivery options, but hopefully this inspires you to look up what is available in your area to help you improve access to nutritious food. So moving on to community supports. In the I do want to take a moment to really highlight Meals on Wheels. It's my favorite community support. I'm not biased at all. In Canada, each Meals on Wheels is unique and independent. We all share the same name, but we're not related, we're not affiliated. So what's done in one area might not be done in another, or it might be done differently. So that being said, most municipalities have some sort of Meals on Wheels that provides prepared meals delivered right to your door for a reasonable cost. And most of these services are available to older adults or those who have a disability or are dealing with some medical challenges. Now, some key differences that you'll have to kind of fine tune for your area is like the production facility. Some of these Meals on Wheels might get their meals from a local hospital or a seniors lodge. Some of them might make their own meals in a community facility or a community kitchen. And then some, like Calgary and in Edmonton, we have our own production facility that is dedicated to making meals for our clients. And then program offerings will also vary. So you'll have to look up your local options to learn more about the delivery time frames, the meal temperatures that are available, and the different types of meals that are offered. The ability to safely accommodate special diets and allergens will vary as well. Some might not be able to accommodate any of those, and others might be able to do many of those. And most of these will have some sort of cost associated with them. But many Meals on Wheels organizations also do some fundraising to help subsidize the meal costs for everyone, and may even offer specific subsidies for those with even lower income. Now, to find your local Meals on Wheels, it might take a little bit of sleuthing, but in some of our rural areas, Meals on Wheels is often coordinated through the local FCSS, which is the Family and Community Support Services, FCSS office, or it might be the local food bank or the local senior center. And so you can find those locally and connect with them to see if they have a Meals on Wheels option. You can also try calling 211 anywhere in the province to ask for these kind of navigation supports to help you find the closest Meals on Wheels. And if you have access to the internet at home, you can also use informalberta.ca, which is kind of the backbone database for 211, and you can do a search yourself. And if you just type in Meals on Wheels and put in your postal code, it'll show you anything that's in that area around you that uses the name Meals on Wheels. And that way you can then connect with those. And then the link here also to the FCSS website. Again, with a simple postal code, you can find the closest FCSS office to you. And these offices are great, not only for connecting with the local Meals on Wheels, but also with connecting with other community supports that might help you in other areas of life as well. And then, of course, there's the Caregivers Alberta Resource Roadmap, which I'm sure you've all heard about in the Caregivers Alberta newsletters and whatnot. And I know that Genevieve is on the call today. She's the navigator. So I know that for caregivers specifically, obviously Caregivers Alberta is here to help you navigate some of this as well. So next up, I do want to talk a little bit specifically about Calgary Meals on Wheels. So for those who are in the Calgary and surrounding area, I just want to highlight a couple of our programs for you. So our Chef's Daily Special is our primary program that most people think about when they think of Meals on Wheels. It's that daily knock on the door, here are your meals for today. It's a 3-week non-selective menu. It rotates, so there's lots of variety. And we are able to accommodate many different special diets, allergies, intolerances, and texture modifications. And our service is available 3 to 7 days a week. So for folks who don't need it quite as regularly, they can just get it 3 days a week, and then they can cook for themselves or go out for meals on the other days. Or if they need that full-time support, then we're there 7 days a week. We deliver the weekend meals on Friday. Our intake process is done mostly over the phone. You can also do it via email, and we do include income verification if you're interested in getting an extra discount on the meal price. And the really great thing about our services is that there's no wait list. So once the intake is complete, we can start meals in 2 business days. And I have been on the phone with caregivers and clients alike, and I can actually hear the sigh of relief when folks sign up for our service. And so I just want to really reiterate that this kind of service is here to serve caregivers and their loved ones. So please, if it's something of interest to you, give us a call. And I'm sure other local Meals on Wheels organizations in your area would be happy to hear from you as well. In Calgary, our fees are $14.25 a day for that lunch and supper package. And again, there's discounts on that based on income. Our meals are delivered by volunteers, which provides a great opportunity for some social connection, especially if we're having a hard time getting out of the house or are not able to go out to our usual social events. And then it also creates great opportunity for what we call our More Than a Meal projects, where we have different community agencies who want to do something special for our clients. So we have florists who donate flowers to us, and we have another agency who donates birthday gifts for our clients as well. So really great opportunities for some of that social connection, not to mention just getting to know our wonderful volunteers during their deliveries. Our second home delivery program is our My Choice menu. And this one is a frozen line. So everything is frozen and there's more than 75 items to choose from, including individual meals, family size entrees, soups and baked goods, and everything's got a la carte pricing. And there are some special diets available, and we can do all of the orders right on our website. So you're welcome to go onto our website to look through and see what we've got. And then again, those meals will come out 2 business days later. And this program is great for folks who want a little bit more flexibility and choice. So you get to choose how often you get the service, whether it's once a week or once a month. And then it's also flexible in the choice of the meals. You get to pick exactly what you want. You can read the description and pick your favorites. Our promise to our clients here in Calgary is that we prepare and deliver quality, nutritious, and affordable meals. And we've got our registered dietitian, who you just met, our Red Seal chefs, over 50 staff, and over 400 volunteers who are here to support you and your loved ones. Now, I do want to mention that our friends up in Edmonton do have very similar programs to what I just described. So for anybody on the call who's up in Edmonton, just know that they too have kind of a daily fresh service and a frozen menu that you can select from on their website as well. So for those up there in Edmonton, feel free to check out Edmonton Meals on Wheels website, and you can read through more of their program information there as well. Now, coming back to the Calgary area, I do want to mention our regional program. We recognize that not everybody gets to have a 16,000 square foot production facility dedicated to their Meals on Wheels. And so we're very fortunate here in Calgary. And so we've created partnerships over the years with some of the surrounding areas to help get our quality and nutritious meals out to some of those other rural and more remote areas. So we've got partners in Chestermere, Cochrane, Strathmore, Wheatland County, and Longview, Alberta. And so if you're in any of those areas and are interested in, learning more about Meals on Wheels, I do encourage you to connect with our partners that are here on the screen. Some of them are through the FCSS office, some of them are food bank or seniors clubs. And if you're not in one of these areas, but you're close to the Calgary area and you want to explore a partnership with us, let us know. It's really quite simple. Our regional partners place one large order for all their clients, and then they send a volunteer into the city to pick up those meals and take them out to those areas and distribute them to the clients in those local areas. So it's really great for folks in a rural area or those small towns where maybe they don't have a Meals on Wheels facility. And again, they can order as frequently as they need to for serving those clients. So that is a lot of information, but that is going to conclude our presentation for today. We covered a lot, but we also hope that we are leaving you feeling really well equipped, empowered, and inspired with all of that nutrition education that Suneet provided and some suggestions for accessing nutrition support. As a parting gift, Suneet has summarized all those key takeaways from his presentation today in this handy slide, which we know that Caregivers Alberta has offered to email out to everyone, so don't worry, it's coming to your inbox shortly. And as Suneet reminded us, when we're overwhelmed with all the amount of information and the choices, we just need to focus on that first next step. So we're going to end our presentation today with a little poll as to what your first step will be. So we've got a little poll here. I think our friends at Caregivers Alberta are going to set it up for me. And if you want to it should pop up there, and you can just add, what is going to be your first next step? Are you going to be eating regularly and scheduling your meal times? Are you going to be boosting your nutrition with different add-ins like those cannelli beans, or choosing to get the fortified pastas? Or are you going to reach out to a local Meals on Wheels? Let us know in the poll what you've got, what you think your first next step is going to be. And I'll give you a minute to think through that.
Responses are coming in. About half of people have responded right now. We'll give it another 15 seconds, maybe.
Sure.
It is a long list. We can make sure people have a chance to read through it.
There's a lot of great information there, and that's why we wanted to make sure that we left you feeling like you're a little bit more focused on that first next step, because there's a lot of great information and resources today. And I think it was said earlier in the chat, but I do want to just clarify that we will be sending out the slides from today's presentation as well, so everyone will get a copy of those as well.
Okay. Looks like responses have stopped coming in, so I'm going to share the results.
Awesome. All right. Staying hydrated. That's a great one. That seems to be the leader here at 33%. And boosting meals with nutrition add-ins and practicing some smart snacking seem to be the second too. So that's great. You know what? I learned the same thing when I listened to Suneet's run through the other day. I was reminded of my snacking habits that could be improved as well. So thank you very much. I do want to just say thank you to Caregivers Alberta for giving us this opportunity to really highlight the importance of nutrition for everyone, but particularly for our caregivers who are already giving so much of themselves. So thank you guys very much for your attention today and for your spotlight on this important topic.
All right. Suneet, if you can just stop sharing for a minute, and the three of us will pop up on the screen, hopefully. Let Matt figure out the details in the background as he pulls us all up. So first, I want to say thank you both to our speakers for those lovely insights. As we move into the Q&A, quick reminder, you can use the Q&A feature down at the bottom of your Zoom to type in your questions. As I was looking at that polling list, I wish I could have entered a few things. I wish I could have made my selections, but as host, I wasn't. And, I never thought of the boosting, the adding of those things in. When you're talking about the Canalian white beans, that's really interesting. And I never thought of that. And, my family, we supplement some stuff in and add some stuff. It's how we kind of hide some stuff in our food for our kids because they don't like vegetables or fruit most of the time. So I thought that was interesting and great. And, and then I also, child of the 90s, thinking of, all I can order was Chinese food and pizza back in the 90s and all the options now. However, I will say one of the challenges is if you look at Skip and Uber Eats and all the hidden fees just drives me nuts sometimes, how much the fees are in that.
Absolutely. It's definitely a costly one, but I think it's also one of those things that, again, it can help people help you. And so that's why I wanted to highlight that, because it is something that is so easily giftable.
Yeah. For our family, don't shoot me on this one. My kids love McDonald's.
Mm-hmm.
So when my mom gift cards McDonald's to us or a gift certificate, I'm like, it's one less meal as we're driving or going around and doing stuff. Yeah. So it's an easy thing to do. So appreciate those as well. So we do have some questions that have come in. And one of our first ones from an attendee online is, I find label reading while trying to shop either with my care recipient or during respite so draining. And I can relate to this, trying to stand at the grocery store and figure out these labels.
Yeah.
I'm already trying to budget, quickly get out and get home and navigate obstacles like weather and traffic. What do you suggest to caregivers who are overwhelmed from making healthy choices?
I think the biggest thing, and I kind of alluded to this at the end, is one at a time. So the goal is not necessarily to do it all at once. Let's baby step at a time. So let's say if we are looking at nutrition labels, we decide, okay, I will take a look at my biscuits that I'm buying today. That is the one product where I will spend maybe an extra 30 seconds to a minute on this product this week. Next week, I will choose something else. Those small changes over time will add up. And if anything, if you try to do too much at once, it'll become so overwhelming that you will fall off your wellness journey and you will stop making that progress you were initially making. So it can be very tempting to make a lot of changes all at once, because I have now told you, or you've read somewhere online, that they're healthy changes for you, but you will overwhelm yourself by trying to do too much at once. So tiny little baby steps, break it down as much as you have to make it sustainable and not overwhelming for you.
And if I can add to that, Suneet, As a celiac myself, I have to do a lot of label reading. And the first few times doing that at the grocery store was absolutely overwhelming and very frustrating with kids in tow. But then I started to learn which products I could trust. And I still have to check every time. I still have to look every time, but it's more of a glance now instead of actually reading the whole label. So you'll kind of start to build up that repertoire of products that you know. And then again, with online grocery shopping, a lot of those suppliers are now putting labels online. And so you can look and read the labels right there online. You can even save some of your favorites and even set up recurring orders for some of the things that you know you're going to need to keep well stocked. So something to think about too if you've got those digital tools to help.
Great, thank you. Um, More of a comment, but I'm hoping you both might be able to talk to this. Someone wrote, I love the AHS wellness kitchen classes. They are all free. Can you talk a little bit about those AHS wellness kitchen classes if you know anything about them or?
I don't know a ton about them other than, my mother has gone to a few of them. So there are some that are free, and there's also some that are not, that you have to be referred to through your GP. So obviously, look at the AHS website to see if there's any that are in your area, but then also talk to your general physician or dietitian if you're able to meet with them, because they might be able to refer you to some of the extra ones that might be more pertinent to your specific health challenges.
Another question. I always understood Meals on Wheels catered only to seniors. What is the usual eligibility? Neither I nor the one I care for are seniors.
Well, that is one of the things that here in Calgary, I have said over and over again, and I will continue for the remainder of my days. In Calgary, at least, we are open to anyone regardless of their age. And I know that many other Meals on Wheels are following suit and do something similar as best as they're able. Meals on Wheels, yes, traditionally was aimed at helping older adults age in place, but we recognize that older adults are not the only ones who are experiencing challenges accessing proper nutrition. So most will have some sort of either complete openness to anyone, or they might have some other parameters that they do allow, especially with medical or health challenges. And so for anybody who's a caregiver, I would think that you're at a pretty good shot of accessing some of those supports.
Great. Um, a question I have that as you were talking, you talked a lot about the various nutritions that come with food. There's also a lot of talk lately and nowadays around supplements and supplementing with vitamins. What are your thoughts on, utilizing vitamin supplements? Some of those supplements support your nutrition and diet and health and so forth. For example, around vitamin C, vitamin D, so forth, in support of that nutrition or health journey for caregivers.
I find that a lot of people will often over supplement. They are not lacking in nutrition as much as they think they are, yet they're buying these excess nutrition supplements and then unfortunately more or less just peeing them out. Um, and so it gets tricky where, in my opinion, while sure, let's say a multivitamin is fine, but maybe we don't have to go to that extent without visiting a GP first, or even doing one of those nutrition check-ins, for example, that AHS nutrition check-in for older adults, that will provide you with a general idea of how you're doing when it comes to your nutrient intake, or if you meet a dietitian and they can give you a rough idea as well. I would not go ahead and just supplement willy-nilly unless you know for sure that there is some sort of deficiency there. Yes, and as Darren mentioned, supplements can be very expensive. So if you're unnecessarily over supplementing, that's an extra cost down the drain.
Yeah, definitely. Um, this is not necessarily, well, kind of is. I always feel guilty about not wanting to cook. I
Mhm.
think we all relate to that in some degree. Uh, I really am so tired in the evening. Are M&M Foods okay as another organization or company to use in terms of nutrition supports and meals?
You want to take this one, Christine?
Sure. I'll start. You might have more
Yeah.
to add to it from the nutrition perspective. I mean, M&M is another product out there that's readily available in a lot of places. And so again, to Suneet's point, making sure that you're eating is more important than, skipping meals. I think the big thing that you have to be mindful of is some of the additives that are in those and salts particularly. But I'll let Suneet talk a little bit more about the nutrient comparison. In years past, we had done some analysis with our meals and others from store-bought varieties. And there was definitely a difference in the calories and some of those key nutrients, including salt. And so ours were healthier, but again, we're not necessarily available to everyone. And so for those who don't have as many options, I think that, doing something is probably better than nothing. But I'll turn it back over to Suneet for a final comment.
Yeah, more or less that's what I would say as well, is we need to rely on those convenience foods. Eating something will always be better than eating nothing. I would much rather you have a nutritious meal from M&M's than to, grab a chocolate bar out of the pantry and then that's the only thing you're eating. And that's kind of where those pairings that we talked about how to build a healthy meal come into play, is take a look at what you're getting from M&M's. Do you think you're missing any starches or protein or fruits or vegetables? If you are, add that in. Chances are it'll probably add a little bit of fruit or veg. As I mentioned, munch on an apple afterwards. And there you go. You've made up for the nutrients that you might have been missing in that meal.
Great. And we have time for one more question. So I have one more here. Where do you recommend shopping in Alberta for affordable yet nutritionally rich foods? And what specific store brands or local markets usually offer the best value while meeting nutrient dense criteria? Now, I know you can't support any specific company, but general idea of where you think would be good. So,
as Christine mentioned, I would use those customer appreciation days, those sale days to your advantage. I would not try to be loyal to any specific brand because each store will have different promotions at different times. When it comes to specific companies that might have a better bang for your buck, you'll probably be looking at those no-name brands or in-store brands like Compliments from Safeway or No Name from President's Choice, where those are good enough and they're priced very, very competitively. So they end up being your best bang for your buck. Paying extra for those name brand products won't give you that extra additional nutrients, but you're paying a lot more. And so I would probably try to go for those in-store brands.
Great. Thank you. So, to wrap things up, I really want to say thank you to both of you for joining us today and sharing this excellent information. As we come to a close here, I do want to remind folks, and I think Genevieve has posted a few times within the chat that, at Caregivers Alberta, and thank you, Christine, for the plug as well during the webinar, that, one of the things we offer as an organization is to help with that navigation and that information support. So one of the resources I want to mention is, Genevieve was on the chat putting in information and email addresses and stuff like that. So Genevieve herself is our navigator and is available to help find those resources if you're unsure. So yes, there's 211 out there and other sources, but we also have what we call our resource roadmap, which is a database not only of other nonprofit organizations and so forth, but also for-profit companies where it has that information around meal prep, meal service programs, but also things like transportation and so forth. So that has been posted in the chat, and we'll make sure to share that out with all of you folks in an email post-webinar. And lastly, as a brief reminder, this webinar was recorded, so we'll make this available for all of you very shortly, along with any resources we've shared throughout the session today. On behalf of Caregivers Alberta, thank you for spending your time with us. We wish you all a wonderful rest of your day and look forward to bringing you more informative webinars in the new years. And again, one last thank you to our excellent speakers for the day, Suneet and Christine. Thank you for being here to present and share all this excellent information. And we look forward to working and connect with you in the new year again. So
Wonderful. Thank you so much, Keith.
Thank you for having us.
Bye-bye.
thank you, everyone. Have a good bye.